Anyone who wants to go into a career in medicine or simply wants to work with the elderly has heard about the opportunity to get clinical hours by working as a CNA or a certified nursing assistant. Everyone is told that by working as a CNA, you gain the nurse's respect, you know the residents the best, and you pretty much spend the day getting to know people. What's not to love? The real question is, however, how do you become a CNA? Well, in today's speech, I will explain the easy steps on how to seamlessly transition into a healthcare facility as a CNA, which includes the following: taking a class, begin your clinical training, take your certification exam, and then working as a CNA in a facility of your choice. Let's start by understanding that you need to take a certification class in order to begin your journey towards becoming a CNA. The first step is to find a local facility to take your certification class. You are required to have a high school diploma or a GED in order to register for this class. There are many easy ways to find classes following your high school education. Look for local facilities that offer classes by either calling skilled nursing facilities, looking them up online, or working with your school's career coordinator and finding classes near you. Facilities that usually offer these classes are hospitals and skilled nursing facilities, which around us include St. John's, Aventera, and our 2 local hospitals. Your doctor may also have information on classes offered if you speak to them. The certification class is usually about 4 to 6 weeks long, and you learn almost everything you need to start working in a nursing facility. That may seem like a lot, but you're taking care of a lot of people at one time and you're working pretty independently. So you really need to get these hours in order to take your test and nail it and be a good CNA. You learn how to take a manual pulse, a manual blood pressure, a respiratory rate, which is how many times a person breathes in a minute, blood oxygen level, weight, and pain level. Usually you won't be taking weight and pain level because it's kind of a nurse's thing, but sometimes they will ask you to assist. You will also learn how to feed, bathe, brush teeth, and take care of your residents' belongings. All of these seem fairly self-explanatory because it's something that we all do in our daily lives, but residents, as they are elderly, require special care because they are fragile, have trouble moving, and can't do a lot of stuff on their own anymore. So they rely on us a lot. And one slip up can really damage their health, so you need to be really careful when taking care of them. Now, following your certification class, you must be scheduled to take your certification exam and then begin your training. Your class instructor will help set up your time to take an exam. It will be within 120 days of taking your exam to following the class. During the time between your class training and the exam, you must complete 25 to 30 clinical hours in a skilled nursing facility. This is according to the Certified Nurse Assistant requirements in Montana. Depending on the facility, you will be hired at the place you took the certification class to get your clinical hours. Skilled nursing facilities are the most common places to complete your training. Skilled nursing means that patients or residents that you are caring for need extra help and are under constant supervision. A lot of them need help with their activities of daily living, which, like I said, is feeding, brushing their teeth, range of motion exercises, and anything that you do on the daily, they need to do too. So our residents are cared for by the certified nurse assistants to help them with that. So examples of these facilities, like mentioned, are hospitals, nursing homes, assisted living homes. I know for a fact that St. John's offers a class, offers you to take your clinical hours there, and then offers you a job. For the exam, you'll be formed on everything you need by your instructor. It's usually some piece of identification, a pencil, and maybe a mask, depending on coronavirus right now. According to the Certified Nurse Assistant requirements in Montana, the written exam in Montana consists of 72 multiple choice questions, which you need a 75% to pass. The skills test is an interactive test on your knowledge of hand washing and 5 other random skills out of your skills that you've studied. So this is a 2-part test. You have the written and the skills. Skills is interactive, but it's only 5 along with hand washing, so it should be pretty easy if you've taken the class. You need an 80% to pass that portion of the exam, but you'll get 3 tries to do all the exam to pass. Once you're certified as a CNA, you will begin working in a facility. It will usually take place at wherever you had your clinical training. Most working facilities, as in any industry, have a probationary period. It's usually about 90 days, and you need to be really careful and tread carefully and follow the rules accordingly. As a CNA, you really can't make mistakes because it could result in serious injury or sometimes even death. So you need to be really careful. Along with that risk, you must follow the protocols. That includes HIPAA, fire safety, transferring, anything that could do harm to the resident or to your career. You really need to pay attention to during this probationary period and following it. If you have any questions about what you should be doing, ask a nurse or a fellow CNA because they will be able to help you and make sure you don't make any of these mistakes. All right, so now that you've learned the steps to becoming a CNA, I hope that you have a great experience in the industry. And even if you have no interest in pursuing a career in the medical field, becoming and working as a CNA is so rewarding and extremely eye-opening. You care for the people who cannot care for themselves. You get to know them like no one else can, even the nurses and their family, and it's amazing. You develop this amazing relationship with these people. If you're struggling to find a job, I suggest trying to be a CNA. Take a chance, especially if you find instant rewards amazing and it's a great feeling and you like the elderly community because they are amazing to work with. Thank you so much.